Hello everyone, myself Dr. Manohar Garwadia, interventional pain physician. Today we are going to do a very sophisticated procedure, radio frequency ablation of the knee joint. This is, we can say, it's a miracle in the medical science. Those who are suffering from the chronic osteoarthritis of the knee joint, and this is a very luxurious procedure for those patients who are not willing to go for the surgery, replacement surgeries, and having lots of other comorbidities, and if there is a contraindication of the surgery like obese, high BMI, and any other disease due to which the surgery cannot be possible in those patients. So we will start with the discussion of the X-ray of this patient. The patient is around 60-year-old and name is Gulab Devi. And you can see this is the classical grade 4 osteoarthritis, in which there is reduction of the joint space, there is a degeneration of the bone, and large osteophytes is there. So in radio frequency ablation, patient will be in the supine position, and the affected knee in which we are going to do RFA is to be slightly flexed, like we are 25 to 35 degree. With the help of some sandbag and some support, we can say how the patient knee lies. This is the Siam view of the left knee joint, and I'll explain that what will be the target points of the lesioning in the RFA of the knee joint in this patient. Our different location of the lesioning in the genicular nerves. So this is the superior medial, this is superior lateral, this is inferior medial, and this is the inferior lateral. So we can say our target point is the junction of condyles and the shaft of the femur or the shaft of the tibia. So our lesioning point will be here, here, and here. This is the lateral genicular nerve at the superior medial junction of the shaft of the femur and the condyle. After injecting the local anesthetic agent, we will wait for some time to proper effect of the local anesthetic agent. This is the third point where we are going to lesioning of the genicular nerve. This is the inferior medial side for the genicular nerves, and this is junction of the condyle and the shaft of the tibia. Again, we are injecting 2% lignocaine for the local anesthesia. We should inject the appropriate amount of the local anesthetic agent, so patient will not feel any pain during the procedure. The fourth site, this is the fourth site. This is optional. Some pain physician do or some may not do. I usually prefer to do for increase the pain relief or increase the effectiveness of the procedure. So this is our fourth site. This is subpatellar branches of the genicular nerves, and again we are injecting the 2% local anesthetic agent. In osteoarthritis of the knee, the pain signal of the knee joints which carry the pain from knee to the brain, especially in this procedure, what we are doing, we are just blocking the pain signals which is going from knee joint to the brain. The sensory nerves of the knee joint are femoral nerve, obturator nerve, and tibial nerve, and common peroneal nerve. Common peroneal nerve lies here. So common peroneal nerve is a motor in the nature. So this part, inferior lateral, will not be ablated because of here is the proximity of the common peroneal also there. And this is the RF cable. This is the RF cannula for the knee joint. The size is 17 gauge and 75 mm length and 4 mm active tip. And this is here to connect to the cable, and this is the RF needles. By help of this, we will insert our RF probe inside the needle, and after that we will start our lesioning. So now we are going to attach the parts of the machine, cable, probes, and in the cable here there are 4 port we can see A, B, C and D. I am using the one port. S, this is a unipolar procedure, so we are using the ground plate also. This is, here we can say this is the ground plate. So we can say there is a two graph for the one for the power and one for the temperature. We will do the listening at superior medially, superior laterally and inferior medially. At every listening will done at the 60 degree centigrade temperature and the time for 150 seconds at each listening. And as I told that this is US FDA approved procedure. Before that, the conventional or the standard radio frequency ablation of the knee joint was not US FDA approved because the lesioning was small. Here the lesioning is big, so the chances of the pain relief in the COOLIEF technique is better or more. So this is FDA. Here the lesioning will be spherical and larger, and in conventional RFA there is an elliptical and very small lesioning was there. We are doing this procedure in operation theatre because I am using SIAM for the proper position of the needle. But nowadays, with the advancement of the technology, so it's a very sophisticated procedure in which this RF machine is producing radio frequency waves, and the radio frequency waves just reaching around the nerves, and listening is, we are creating a listening around the nerves. So the pain signal from the knee joint to the brain is blocked by this procedure, and it's very simple technique and done without any general anesthesia, without any complication. The chances of bleeding is very rare. This is a radio frequency ablation technique, and apart from the osteoarthritis of the knee, different types of the other conditions in which we can use this COOLIEF RFA machine, like facet joint arthropathy, like blockage of the different type of the ganglia in the shoulder pain, and there is a blockage of the abdominal ganglia in the intra-abdominal malignancies, and like trigeminal neuralgia ablation and stellate ganglia block. Different conditions this machine we are using, and it is excellent, and it's a great technology in the pain medicine. So we seen how sophisticated and the simple this procedure was, and as I told, I prefer to do on the subpatellar junction also to increase the effectiveness of this technique. Started the listening at the subpatellar junction. So as I told that the indication of this procedure is who not willing for the surgery, very obese, or any other contraindication in which patient will not operated, or there are lots of contraindication. And in osteoarthritis, it is indicated in the grade 2, 3, 4 and moderate to severely osteoarthritic knee. So this was the whole procedure. So first of all, the patient is supine and the SIAM will be AP. Check in the AP view of the SIAM the positions of our needle at the junction of the condyles and the shaft of the related bone, and after that the local anesthetic agent we will inject, and after checking sensory or motor response we will start the listening. The whole procedure will take around 10 to 15 minutes, and it's under the local anesthesia, so patient can go home just after the procedures. It could be OPD procedure also. If there is ultrasound we have, then we can carry it out in the OPD also. It's very safe, less cost, less time consuming, and without any major complication, infection, bleeding or cutting, any tissue cutting measures.